Good evening. Welcome to MicroBiotics BioTalks Infectious Disease mini series. We've started some few weeks ago, and we're doing it gradually. And this evening, I would just like to talk about another common respiratory diseases. Well, not that common anymore because in large part of the developed world, the disease has been taken care of by active immunization. So, what we'll be discussing this evening is diphtheria, an infection caused by an organism called Corynebacterium diphtheriae. So we'll be talking about this disease and, of course, what causes it, how it's being caused, and the treatment, just general information for everybody to know how to go, to have the knowledge about it and go about the treatment and control and management in case somebody contracts the disease. So, diphtheria is actually a toxin-mediated disease. When we say toxin, that means that the organism, the causative organism, produces a toxin, a biochemical that causes the effect, that causes the symptoms that we see about the disease. Like I said, in developed parts of the world, it's part of the vaccination process, so it's not really much of an issue over there, and it's not much of an issue also here, but because I believe we have, I don't know, I think I'll have to verify if we are being given diphtheria vaccine in Nigeria. When I have that information, I'll get it across to you. Diphtheria actually starts, the symptoms, the signs and symptoms starts with sore throat and then slight fever, with extreme tiredness and fatigue, and after a while you're going to experience a swelling around the area, around the neck region, and with time there will also be formation of a pseudomembrane on the tonsil and the throat and in the nasal cavity. So dramatic symptoms and signs can occur in severe form of the disease in terms of heart and kidney failure and even paralysis. Like I said, the infection is caused by Corynebacterium diphtheriae, and this organism, it's one of the microorganisms that produces what we call toxins, and of course the name of the toxin for this particular one is diphtheria toxin, which is actually a very, very powerful exotoxin that causes majority of the symptoms of the disease. It's the organism is actually the organism is not actually dangerous by itself, but it's the toxin that it releases that is extremely dangerous. The organism is not invasive. When it gets into the body, now I'm talking about the pathogenesis, the way it causes disease. When it gets into the body, it doesn't enter the blood, it doesn't enter the tissue. It usually grows in the throat. It grows in the throat, and from that location, it releases these toxins. Now, this toxin will form what we call a pseudomembrane, and then this membrane now can get loose and obstruct the airway, suffocating the patient. The toxin may also find its way into the bloodstream, and it can eventually get to the heart, to the nerves and the kidney, and cause extensive damage and failure. like I said, the microorganism is not actually the cause of this disease, but of course it's the cause. So the way to avoid it is not to actually get it's actually not to contract the organism. In terms of epidemiology, the organism is actually being transmitted by humans, primarily being transmitted by humans, and like all respiratory diseases, is being transmitted from the respiratory tract, either through coughing, sneezing, anything that will bring should I call it that will bring all the throat sediments out. And most of the time when we cough, everything that is in our throats also comes out. So and it's also one of those diseases that's one of those organisms that stays on fomites. Those are inanimate objects. So if somebody sneezes into his or her hand and uses it to maybe touch the door handle, and of course once you touch the door handle as well, you've already gotten the causative agents. So the best thing is not to allow that hand reach your throat or to get into your respiratory system. So of course, like I said, it's also caused by inhalation of these infectious droplets. Now, in terms of treatments, like I said at the beginning of this talk, most of the developed world, they found a solution to it by giving vaccination. They give vaccination as part of childhood vaccination, because they realize that you might not really be able to stop people contracting the organism, the microbes, the causative agent. So but you can, of course, sensitize the body against it. So you get the vaccine when you are young, and then with time, the body gets used to it. But the disease is actually a very dangerous one. Statistically, 1 out of 10 patients who contract diphtheria usually dies, because it's actually a very fatal infection. Once the toxins enter the blood, it causes a lot of damages. In terms of antibiotics, the most common antibiotics being used are erythromycin and penicillin. And like I said, this, like no them say, I haven't said this. These drugs, these antibiotics, only have effects on the organism producing the toxin and not the toxin itself. So if you're given those drugs, you're killing or inhibiting those organisms and not stopping the effect of the toxin. So the idea is to definitely find a way to stop the organism from producing the toxin. So, and that's actually very difficult to do, because once it gets to the system, you might not really know. The symptoms being given looks like symptoms of other microbes as well. So, you might not really know that it is this particular organism until the toxin starts producing its effect. So that's why it is actually extremely very, very important that the vaccine is being given at childhood, so that people will get resistant to it. The only issue is that immunity decreases with childhood, so we usually get what we call a booster, should I call it booster vaccine, booster injection every 10 years to maintain the protection. So like I said, I'm going to find out, and I'll get the information whether we have access. I think we should, because I don't think we've had cases of diphtheria disease in Nigeria. It's not as common as other diseases, though I can't be 100% sure. So I'll get the information of whether we have access to the vaccine here in Nigeria, and then I'll get it across to you. So that's all for our infectious disease mini series for today. Thank you for listening. I'll be seeing you some other time. Cheers.